So in 2020, I want to just give you the feeling of what was happening at that point in my life and a lot of people's lives, right? It was April of 2020 and COVID was running rampant. So here I am getting ready to take on this huge commitment of becoming a primary caregiver. Something that you don't know until you're actually in it. People talk about it. They talk about having to care for a parent or any loved one, really, and you really don't get the sense of it until you're in it. And once when you do get into it, it's something that just happens like immediately, and it's frightening. During COVID, it was even more frightening because there were no resources available. All I had was myself and Google. I was told by nurses, people from social services had been assigned to my father's case that they could find us help, but I want you to remember, we were during COVID, there was no help to be found. So I had to take on finding the resources available to help care for my father while he was in my home. A lot of researching on Google, trying to find resources to support his care, to find out what I needed to do financially, to find out what I needed to do legally, to find out what I just needed to do day to day to help him live his best life in his remaining years. So fast forward a little bit. As I started to get a little bit of a rhythm going, I realized that it was going to take a lot out of me, a lot out of our family, trying to manage everything. I am an executive coach, and I, at the time, was running a company where I actually had two companies. I was coaching in one, and I had a software company as well. But either way, I also had my father in the background. I can remember many Zoom calls where I'd be on a call with, it could be anybody, a CEO, it could have been an organization, and all of a sudden my father would walk through the background of my Zoom camera. So I had to come up with somebody to help me. I had to find somebody to help me care for him and his needs. At some point, while I was Google searching, I found the term geriatric care manager. I had no idea what that was. And I found this woman, actually I think it came through the Eddy. Somebody had recommended this woman to me, but she was no longer in this area. I think she moved to Pittsburgh or something. And we connected on LinkedIn and we had a conversation, and she mentioned Everhome Care Advisors. She said, they have care managers. And I said, I don't even know what that is. Can you help me understand? And she basically said that what people could do that were in her same role could help me navigate some of these challenges that I had. Specifically, the legal side, the resources available, how to track things, what doctors might be necessary, what care could be available in terms of having somebody come in and actually help and provide a little bit of respite for myself, my husband, and actually my son was living with us at the time. And she mentioned Karen Wolff. So I gave Karen a call. I said, do you remember me? We talked outside right in Schenectady at this workshop, and I need some help with my dad. My dad is now living with us full time, and I have no idea what to do. I can't find help. Nobody will come into the house unless we wear masks, and try to tell an 80-plus-year-old man during a pandemic that he has to wear a mask in his own house. Wasn't gonna go well. So anyway, she came in and helped tremendously, told me about what Everhome did, the assistance that she could provide. Also recommended that I talk to PIERRO about making sure that my trusts were set up, that all of the legal side, the power of attorney, the healthcare proxy, all of those things were taken care of so that when the time came, or if I needed something, I was in charge, I was in control, and we didn't have to worry about, some doctor or some nurse saying that I couldn't get the information that I needed or that I couldn't make the decisions that needed to be made for my father's care. So the other side of Everhome, which was amazing, and I'm a techie, so I really appreciated what they were doing, was this tablet. So remember, this is back, I think it was 2020, 21, I'm not too sure. And they came in with this tablet. that we're going to need to use to help with navigating all of the things that come with caregiving. And I will say this to primary caregivers, anybody that's out there that has found themselves in this moment where they have just been hit with something unexpected, it's great to plan, but if you don't have a plan, you definitely need to work with somebody like an Everhome Care or their technology, and I'll get into that as well. You need a standard operating procedure, and I know it sounds cold, but it's something that will allow you the space to deal with the emotional side of what happens in caregiving. And I might get a little bit misty because it's hard to watch a family member deal with all of the things that come with whatever diagnosis that they have. So when it comes to planning, like I said, if I would have known about the technology that existed, I would have implemented it immediately. And I probably wouldn't have had such a challenging time in that second year, or from year 1 to year 2 of trying to navigate doctor's appointments. My father had, I believe, upwards of 6 different types of doctors between urology, endocrinology, did I say neurology? I don't even know. General practitioner. I mean, there was so many things and so many medications that needed to be managed. And as I was saying before, Everhome came in with this tablet that managed all of it. And it was amazing, absolutely amazing. I had, prior to this tablet, I had created this binder. And the binder had in it my father and my mother's entire history. Not that you need to put these things somewhere safe, but social security numbers, bank accounts, the healthcare proxy was in there, the power of attorney paperwork, everything related to the home that they owned for 45 plus years. But the tablet was what really, really helped. I was able to not only organize the medications for my father and the times that they needed to be taken, but it had games. And I remember playing the bubble game with him. It was the one thing that kept his attention for a little while, and he actually enjoyed it. The other piece was there is a video component to the tablet and the technology, and we were able to call my mother, my sister, who lived about an hour and a half downstate. We were able to use that to do a video call on a much bigger screen. I think the screen is 15 inches or so it's a lot different than being on a phone. And he was able to just stand up and talk. There was just so many different things that were within this technology that are so necessary, specifically for people. I'm talking talking about somebody that had Alzheimer's. It could be useful for a multitude of other things as well, but these were the things that really kept his attention and allowed me to have a little space every now and then so that I could get done what I had to do. With that, this journey, which has been very, very challenging, I have learned that, again, planning is something that is necessary for all of us. I step back now. My father passed in April of 2024. And I wish, number one, that I knew some of these resources existed. I wish I knew about Everhome, at least when he first came in, and what they could do, because I would have set things up a lot differently. It would have relieved a lot of stress and heartache had I known that I could do some of these things before. And a lot of the times I think about people that don't have the resources that I had available to me. There's people out there that don't have the time to really take a step back and look at, what do I need to do in this scenario? So I have since closed down the software company that I mentioned before. And I decided, after my father passed, so over this last year, I have written a book about caregiving, which will be published in January of 2026. And it goes through really the journey of those 4 years of taking care of my father. I've also created an app myself to try to help folks be prepared and start to think about having some of the conversations with your parents, or even having conversations with a loved one. It could be your partner, your spouse, your children. You never know when something could potentially hit the family where legal matters need to be taken care of, financial matters need to be taken care of by somebody other than the person that needs it. Through this time, another thing that happened was my daughter was actually paralyzed in September of 2024, 32 years old. So I had to do everything all over again. My mother now is at a point where her dementia is getting worse and she needs help full time. But because of what I went through, I already have a plan. And the one thing that I can say is that it is imperative that people take the time to think about what might happen so that you're prepared for navigating all of the different things that need to happen so that you can show up with your full self emotionally for the person that needs care.
That was really good. That was excellent.